The trismus occurs when we usually give an inferior alveolar nerve block and we enter the medial pterygoid muscle inadvertently, because basically being a blind procedure, we cannot be sure about the exact position of the muscle. When we are administering local anesthesia with adrenaline, we cannot exceed a dose of 7 milligrams per kilogram body weight of the patient. And for local anesthesia without adrenaline, it has 4.4 milligrams per kg body weight. We should shift the patient on the floor, on a smooth floor, right? And that is the most effective way of doing it, because if we try to do a cardiopulmonary resuscitation on the dental chair, our arms won't be able to deliver that much of compression, number one. Number two, the padding in the dental chair would be absorbing all the thrusts that are given, so which is not going to give an effective chest compression to the patient. So what happens in syncope is that there is a transient cerebral ischemia that happens and the patient faints. So the first thing that we do in syncope is to call out the patient's name, right? The second thing is, if the patient fails to respond to that, we activate the PABCD mechanism. When a seizure happens, the patient would the patient would turn rigid, and the patient could have a tonic-clonic seizure where the patient tends to just move around in the same position, going up and down, right? And this is a pretty critical situation, because the patient could injure himself because of the sharp instruments that are there or the equipment which is there in the dental operatory. So we should make